Hi, welcome to Askimo TV. We're talking today to Dr. Feilim Murphy. Dr. Murphy is the clinical lead for pediatric surgery and urology at St. George's Hospital in London, specializing in undescended testes and incontinence. Hi, Dr. Murphy, how are you?
Fine, thank you very much.
Dr. Murphy, let's talk a little bit about giggle incontinence. What is giggle incontinence?
Giggle incontinence is a form of wetting that is classically associated with young girls, in which when they laugh, giggle, or have a very, very significant laugh, they wet themselves. Now, there's a number of misconceptions about giggle incontinence. Firstly, that it only affects girls, which is not true. It affects boys and girls. By its name, it sounds like something quite benign and straightforward, and you giggle and you have a little drop of laughter. But in reality, these children can empty themselves completely and have no conscious control of their bladder during this episode.
Which girls are likely to suffer from this condition, or boys, and why?
Well, it is more common in girls. But a small number of boys are affected. The problem with boys is because the vast majority of physicians really don't recognize that it exists in boys. They really get left for a lot longer before they would come to see appropriate medical advice. But it is not at all uncommon in girls. To be fair, girls have a higher incidence of wetting, and they're more likely to be brought to medical attention by their parents much earlier on.
What are the causes for the giggle incontinence?
Oh, that's a wonderful question. That is one of the great unknowns. We have spent quite a long period of time trying to sort out exactly what the cause is. There's a number of arguments whether or not it's caused by a local effect from the bladder and the spine, which really doesn't make an awful lot of sense if you think about it, that the trigger is laughter. A very simplistic way to look at it or think about it would be which isn't entirely true, is that the imaginary laughter center in the brain is having overflow. So when the child is laughing, they're triggering the voiding area. But this is a magical area that I'm not sure really exists. But we do not understand even a lot of the basic dynamics of how voiding really occurs. So when things go wrong, it is very easy for us not to have notion. I would just want to remind people that people frequently wet themselves when they laugh, and even that phrase itself, "I laugh so much that I wet myself," is common across many, many cultures. So the issue of laughter and associated wetting is much more common in society than we think about. And many studies have been done on adolescent girls and teenage girls to find that they frequently have an issue with a degree of wetting when they laugh if pressed in questionnaires.
How is giggle incontinence diagnosed and treated?
Well, the diagnosis is to kind of tease out whether or not there is an episode or an issue of giggle incontinence in any child who has a history of chronic wetting. Classically, these children would have an episode of wetting associated with laughter, and it is a very clear trigger. So sometimes it only happens in school because of a certain child who makes them laugh. Occasionally, there's a certain one parent who has a particular sense of humor that makes the child laugh in a particular way. But there's a very particular trigger for them. It does not tend to occur in which every single type of laughter or every single joke will set them off. It is very particular that they're triggered. A lot of children treat themselves by avoiding these triggers, so they will avoid the child in school who makes them laugh or the parent. And this can lead to quite a degree of social isolation for the child. So the diagnosis is not that difficult once you leave the option open and on the table to be explored and not be excluded because the child is male.
And treatment, how would you treat it?
Well, the difficulty with treatment with giggle incontinence is that it is problematic. There is no medication that will stop you voiding when you laugh. By far the best medication are those for the treatment of attention deficit disorder. Medications such as Ritalin and sometimes benzodiazepines can be very, very useful in treating the disorder, but they work centrally. They have a central depressive effect, And it depends on what culture you work in. In certain societies, it's perfectly reasonable to take medications, and the parents would be very happy to take them. In other societies, the thought of a child being on such medications is extremely depressing for the parent and for the child, and therefore they will refuse to take them. In that situation, if medication is completely unlikely to succeed, one of the key things to do is not to avoid the triggers, but to actually try and allow them to have more control over the bladder on a regular basis. So that if they know they're going to a potentially trigger situation, such as the schoolyard in the afternoon, to ensure that they empty their bladder beforehand so that social drowning does not occur.
Giggle incontinence is a form of urge incontinence. So how does this differ from stress incontinence?
Yes, that's an interesting question. When we talk about incontinence in children, the words stress and urge do come up, but it's a different type of incontinence to what we talk about in adults. The use of urge and stress, they mean two different things. Urge, if you can imagine, is that the bladder itself is triggering and trying to squeeze and trying to empty out, and that may be due to spinal, or local, or brain trigger. And stress incontinence, which is, sadly, people are very common with in the postpartum period, is due to, if you can imagine in a very simplistic way, due to problems with the pelvic floor, so that the gateway, the door, is weakened. In reality, children with giggle incontinence have trigger issues, so they're being triggered to empty when it is inopportune for them. One of the treatments that people have used in the past is to try and strengthen the pelvic floor. In reality, that's just trying to close the door tighter against the bladder squeezing. So it is really more an issue that is a central brain issue rather than a pelvic floor issue.
Thank you, Dr. Murphy. Thank you so much for speaking to me today.
Thank you.